The moral right to health care. First, whose right is it anyway? The right to at least minimally basic health care is a common belief morally among more developed countries such as the United Kingdom, Australia, and Canada. These countries already have what is known as comprehensive governmental health care programs. These programs are there to ensure the health and safety of the citizens of these countries. In the United States, we are currently developing our own governmental health care program under the Affordable Care Act. Bullet points of the Affordable Care Act include health care coverage, quality insurance coverage, and coverage choices for all Americans. Currently in the United States, healthcare is governed by what is known as a code of ethics. The code of ethics is a set of basic health values. These health values serve practitioners facing ethical dilemmas, clarify ethical principles, and also make known an organization's ideals. According to the American Medical Association, physicians are also guided by their own specific code of ethics. And one of the bullet points and beliefs of the AMA's code of ethics is that physicians should support the ideal of medical access for all. In the public health sector, they are also governed by their own code of ethics, and one of their bullet point beliefs is that there is a right to resources for healthcare for all people. Furthermore, there is a moral obligation to ethically allocate resources. Leaders in the healthcare industry have a moral obligation to allocate even scant resources, and they should be guided by the principle of fair resource allocation, as well as trying to serve as many patients as possible. Resource allocation has a profound issue of morality and its effect on quality. Leaders in the healthcare industry have a responsibility of cost containment, and therefore allocating the resources as fairly as possible and to as many patients as possible should guide their allocations. Morally allocated resources should also provide at least a decent minimum standard of resources for all patients and to provide care even when there may not be a cost benefit. Furthermore, healthcare should be guided by cultural competence. Competence should raise awareness, acceptance, and understanding of the role of culture. Principles of cultural competence include the importance of culture in people's lives, the respect of differences of cultures, and to minimize any negative effects of these differences. Cultural competence promotes autonomy, which is the patient's right to informed consent, as well as justice. In conclusion, every person should have the rights to basic health care coverage, and this basic health care coverage should be governed by a strict code of ethics, should include morally allocated resources, as well as culturally competent care. Thank you very much.